everyone. I thought I would give a quick update. I am in Boston, and I am at Mass General Brigham Women's Hospital doing some pre-testing to a possible revision surgery. And I thought, it would be good to probably just record because I'm in the throes of it right now, and just to let you know kind of what today involved. This morning I was over at MIT talking with one of the PhD students that's involved in this kind of a program, along with a Zoom call with Dr. Carty, who created this procedure, along with Dr. Carty, who I'm going to see here in about an hour. And I had been picked to do this type of surgery. It's called the AMI, and it is done here in Boston, and it is done to improve the muscle movement and muscle usage in a residual limb post-amputation. And so, yes, there's a lot to digest in this because my life is actually pretty good and pretty active, but it also is kind of intriguing because it can help with phantom pains is what their hope is, but also allows me to maintain my muscle mass over the years, which is the question I actually asked Dr. Her today, was what would happen if in 40 years, what's my leg look like if I don't have this and it just atrophies? And he said it becomes very painful because you lose all your tissue that's inside there, and it kind of just depletes. So there is a positive to that in the long term, because a lot of times as amputees, we just think about what's happening right now. We don't think about the future. We don't think about what could happen to our sound limb as we get older, and the natural progression and disintegration of bone and muscle mass and stuff as we get older, and women especially with bone density as we get older. So, trying to not worry about the future, but to also be smart and think about it. Can this help that situation? And it looks like it can. So yeah, I did a CT scan because I'm not sure if there's some neuromas. So they are looking at that today. Did the blood work to make sure I am pre-operative a candidate. And then also did an x-ray of my residual limb to see how that's looking, and making sure there's no fractures or bone fragments or anything weird that he wouldn't be expecting if I did this. And I did want to get on today, and you can tell it's really windy here, and it's actually extremely busy at this hotel, or this hospital. Trying to find a place to sit with no one watching is really hard. But I go in and I see Dr. Carty face to face now. I've had a conversation with his assistant. I've had a Zoom call with him, and now being in Boston here, face to face, so he can really talk to me and see me as a person, and he can also inspect my residual limb and make sure there's nothing that's an underlying issue or problem. And I'm excited. I'm anxious. I know that after this meeting, then the decision will be pretty much in my lap, unless he pulls the plug and says no. I think the decision's going to be in my lap, and that means preparing myself for a surgery June 20th, or just choosing to pass. I will have to say that in the last 5 or 6 months, I've had more issues in my socket with pains. That's why the CT scan, and wondering if there is some sort of neuroma growing. But it'll be really interesting. I'm really praying that a clear-cut answer will be availed when I go through this meeting. I did feel much better after talking to Hugh, Her, and John at the MIT lab, just because they firsthand seen it and know it, and Hugh is a bilateral below-knee amputee, and he knows firsthand years of being an amputee what it's doing to his tissue. So there's hope there, and I just thought I would share it while I'm in the middle and before I even meet Dr. Carty, and tell you where I'm at. And I'm hoping to maybe compile a whole video of this procedure and everything if I go through with it. And Dr. Hugh Her has said he would come on my podcast to talk about the AE procedure and whether or not that's something that you're a candidate for too as well. So anyways, wish me luck. I'm going to go in and meet the doctor in about 30 minutes. So talk soon.